All right, anatomists. In this one, we're going to be talking about the lymphatic system. So, the lymphatic system is pretty similar or connected to the circulatory system. If you look at lymphatic vessels and capillaries, the capillaries in the lymphatic system look really similar to the capillaries that you find in your circulatory system, except these capillaries are blind-ended, which means you have this little capillary coming down, and then it just ends. And right here, there are these little special flaps that let fluid in, but stop fluid from coming back out. And as you get into the larger lymphatic vessels, you'll also see valves like we have in the veins. So some similarities here between your blood vessels and the lymphatic vessels. They look really similar, especially your lymphatics and your veins. So if we pop in here, looking at this guy with the lymph highlighted, you'll see a couple things. One, you'll see this larger area right here. This is called the cisternae chelae. The cisternae chelae. And it acts kind of like a really large lymph node. You can see the smaller lymph nodes around the neck. These are cervical lymph nodes, cervical vertebrae, right? And then around here, you have axillary lymph nodes in the axillary region, mammillary lymph nodes around the breast region. You have some cubital lymph nodes here in the elbows. A couple other things you want to see is the thymus. Sitting right here, we'll do a little bit more on the thymus in a little bit. Your tonsils. These are all parts of the lymphatic system. Also your spleen down here. Your spleen's really important in filtering out stuff like old red blood cells. Another part that is important is your red bone marrow. The bone marrow is super important in your lymphatic system as well in your circulatory system, making white blood cells, making red blood cells, that kind of stuff. You'll see a group of lymph nodes in the inguinal region right here, your inguinal lymph nodes, and then you'll have some popliteals back here on the back of your knee. And here are all your lymphatic vessels. So these lymphatic vessels act really similar to how your veins act. And so there's not a lot of pressure forcing them. It's not like there's blood pressure forcing this fluid back to your body. Instead, it is muscular contractions. So when your calves squeeze, it forces this up. And then those valves stop the lymph from flowing back down. If you're wondering where this lymph comes from, it actually comes from your circulatory system. So if you look at your arteries coming away from the heart, and then you get into that capillary system, in the capillaries, you're going to have this section where fluid diffuses out based on pressure. And then as you get over here to the venous system, going back to the heart, the fluid comes back in based on the osmolarity of your blood. So basically how much protein and stuff you have in your blood brings this back in, along with some of your interstitial pressure, this pressure out here in the tissue. But not all of it comes back in. You leave some fluid out here in the tissue. And it's the lymphatic system that takes that fluid back to the circulatory system. So if you look right here, you can see that you have your lymphatic ducts coming back, and then they drain into the subclavian veins. So they drain into these veins right before you get to your brachiocephalics right before it goes back to the heart. And so all that remaining tissue ends back up into your blood supply, unless you have like a clogged lymphatic duct or something. And then you'll start getting edema or swelling, you get fluid building up in these areas. So all that fluid that comes out either gets reabsorbed by the circulatory system or gets picked up by the lymphatic system and delivered back to the circulatory system, so you're not really losing any fluid that way. One of the major organs of the lymphatic system is the thymus. If you look at it, it actually shrinks as we get older. When we're small, it takes up a really large space, but as you get older, you only see it as a little bit right here attached to the pericardium on the heart. What the thymus does is it makes mature T cells. T cells are one of your lymphocytes. They're important in both cellular and humoral immunity. So keeping your blood clean of stuff like bacteria and viruses. And these T cells in the thymus learn, one, can you attack pathogens? If they can't attack pathogens, they get taken out. And then two, can you know what self versus non-self? So which tissues are your tissues, and which cells are your cells, and which cells are pathogenic cells? And if they can't tell those differences, then they get taken out. And so that all happens here in the thymus, where these T cells become mature, learning how to attack pathogens and what cells are actually pathogens. So that's important in immunity and the lymphatic system. So if we look back at our guy again, you can see all these bright green dots are going to be your lymph nodes. When you look at a lymph node, you're going to have a capsule or this outer covering on the lymph node. And then you're going to have a cortex. Here you can see the cortex, and then inside here is the medulla. You have these lymphatic vessels that come in. You have multiple lymphatic vessels coming in. They are bringing that lymph with them, and then they flow through the lymph node. And this lymph node is really acting like a filtering mechanism. So as all this lymph comes in here, you see these germinal centers here. These germinal centers are where you're going to find lots of white blood cells. And so as this fluid comes through, all these white blood cells are checking and making sure they're clean and there's not any bacteria or anything like that. Something a lot of doctors do is they check for swollen lymph nodes. If you have swelling in your lymph nodes, it might mean you have an infection, as these things are building up pus for killing the bacteria and stuff. Then you exit, so these are all afferent vessels going to the lymph node, and then you exit out the hilum via the efferent lymphatic vessel. You only have one vessel leaving the lymph node, and you can have multiples coming in. And so as all these come in, and then they diverge out one. So this one slows down the flow of lymph, and two, make sure that everything gets really clean. And so if we look back at this guy, you'll see that the vessels start out small, but then they get bigger as they come up. Especially in this thoracic duct. So in this big one right here in the chest. And then you have your right lymphatic duct over here that drains a lot from the head and the right arm to empty in there. So the thoracic comes up and wraps around. And then your right lymphatic deals with this part. So, afferent, efferent, the capsule and the cortex, and then you have your medulla inside. Another important lymphatic organ are going to be your tonsils. You have 3 sets of them. You have your pharyngeal tonsils up here in the nasopharynx region, right above your auditory tube. And then back here on the soft palate, you have your palatine tonsils. These are the ones that when you open your mouth and look in the back, you can see these pretty good. They're going to be these ones right here on the side, right? Maybe, maybe not see those pharyngeal ones. Maybe, maybe not see the lingual ones down here. So behind the tongue is where you have your lingual tonsils. It's normally these palatine ones that you're looking at whenever you're like, my tonsils feel swollen. And you can look at them, you can see, wow, those are really swollen, look super infected, right? That's some serious tonsillitis going on right there. Versus on this person, where you can see they're pretty clear. A little bit tonsil there, a little bit tonsil there. That's really normal. Here's the uvula. You can barely see the uvula on this person because their tonsils are so big. The tonsils, when you look at them, they have a distinct shape. You can see these germinal centers pretty similar to what we saw in the lymph nodes. And they also have these tonsillar crypts. So as the fluid in your mouth comes down, it can flow into these crypts, and these crypts can trap the bacteria. And then you have your white blood cells in these centers that can go attack and kill it. So that's basically all you need to know on the lymphatic system. Know your ducts, your thoracic, your right lymphatic, this cisternaceae right here, spleen, thymus, lymph nodes, different parts on the lymph nodes, right? So afferent vessels, capsule cortex, medulla, your tonsils, pharyngeal, palatine, lingual. Oh yeah, also your red bone marrow here. I think that's it on your list. All right, see you next time.